Quite a few. I really can't tell you the exact number, but it's been quite a few. And I appreciate the interest, not only the interest in our efforts here and what's happening, but also the way in which those interviews were handled. They were very respectful. They were obviously inquiring as to whether or not we thought this could be successful, and why pursue this. Yes, I do think it could be successful. If it isn't, it should be. And as you know, about 3 weeks ago, I introduced a bill with some other folks in the legislature to amend the 10th Amendment to the Constitution to make it more clear as to what Congress's powers under Article 1, Section 8 truly are in terms of controlling the commerce between states and, in fact, intrastate. And frankly, I wish I was the author of that bill, but it was Dave Friedenthal, the governor, the Democrat governor of the state of Wyoming. He and I have talked long and hard about the constant infringement by the federal government on business within the state borders, let alone that go out. And so, as you know, there's been quite a few states that have passed and signed into law. Montana, Wyoming, South Dakota are three that at least come to mind. Utah has already passed it, and talking to Gary Herbert, he's looking at all those bills that had to deal with states' rights, and the ones that he figures to sign or the ones that he figures to let become law without a signature.
Governor, when it comes to the basic policy issue of the healthcare reform bill, universal health insurance coverage, do you disagree with the policy that bill is after, or just how it's going about it?
I do disagree with the policy and the process by which it's forced onto the population of Idaho. We got 1,545,000 citizens here that each and every one of them now are going to come under that mandate by the federal government. I think we ought to be able to accept or reject, and every citizen ought to have the power to accept or reject, and Congress has assumed that power, and I think it's wrong. Do I think we need to reform health care? Yes, but point me to one spot in that, all of those pages and all of those briefs and all of those sections where we've driven down the cost of health care. Point me to one place where we're saving money on health care. Point me to one place where we've actually have any kind of tort reform, which has been long used as a reason for the health care costs to continue to go up. The penalties, or the premiums I should say, that doctors have to pay for medical malpractice insurance, and the subsequent tests that seem just exhaustive for a patient today to make sure that they get every test, every possible test that they possibly could. Should they miss one, they'll be sued for malpractice because that one last test could have saved that person's life. As a result of that, we've got a myriad of tests that actually most doctors, except to protect themselves from a potential lawsuit, would probably not engage in.
There are people, though, who like the fact that pre-existing conditions, that will not be taken into account when people try to get insurance. Students who can stay on their parents' insurance until they're 26 years old. There are thousands of Idahoans who presumably probably are thinking, this is my chance to get health care, and you're trying to stop it. How would you respond to those who don't have health care, view this as being a way that they can finally get it?
Well, Todd, I'm not going to say that there aren't some good things in this bill and some worthy things that should have been considered. In fact, if you'll look back at what the Republicans and the Republican leadership in the United States Congress offered, you'll find almost every one of those, including being able to do business across state lines, and including a lot of other free market exercises that probably could help at least more potentially to bring down health care costs than this mess that we've got ourselves in now. So yeah, I fully understand that. Frankly, I don't know how that's going to work. I'd be interested to find out how a pre-existing condition can be insured and not drive everybody's premium sky high because of now of the risk I know that if probably what I would do if I had to go to one of the pools and find someplace, I'm going to find out where there's less and less risk so that my premium is lower. If I'm an employer that's got more than 50 employees, I'm probably going to lay off 4 or 5 of them so that I can get below that threshold that says that I've got to provide insurance. So this is a jobs bill, all right. It's a jobs vanishing bill. All of those things that I think that those folks have claimed there, but I just want to say there's no question there's some good things in the bill. But on balance, it's a violation of the Constitution. On balance, it's a takeover by the federal government of a health care system which has provided the best health care in the world. And I think it's a big mistake. Dan?